We are looking at health headlines this morning with WGN Morning News medical contributor and Northwestern medicine physician Dr. Lauren Streicher. Good to see you again.
Good morning.
Good to be here.
All right, so some headlines. First thing, a warning about painkillers.
Yeah, so this is so interesting because whenever we injure ourselves, whether it's a back injury or a neck injury or a shoulder injury, what happens is that our body sets up an inflammatory response. And the purpose of that inflammatory response is to heal the tissue, to make you feel better. But what's the first thing we all do? We all go for that anti-inflammatory painkiller. And it turns out that that may not be the best move. This was a study of 900 people that had back pain, and what they found is that the folks that use the non-steroidal anti-inflammatories like ibuprofen, their acute pain turned into chronic pain because the body didn't get the time to heal it. So then they did a bigger study of over 2,000 people, and they found that the people that took the non-steroidal anti-inflammatory pills were twice as likely to have chronic back pain because you didn't give the body time to heal. So the message here is not that you shouldn't take pain medication, but you may want to go towards something more like Tylenol, which is actually not an anti-inflammatory medication. And they also found that if you do something like physical therapy, massage, it works just as well as these pain medications when it comes to back pain. So maybe we're just too quick to go for those anti-inflammatories instead of letting our body do what it's supposed to do.
Wouldn't ice do the same thing?
Ice, they actually looked at things like ice, heat after the first 24 hours, massage, PT. Now, granted, there's pain and there's pain.
Yeah,
but
right.
the point is you can choose your pain medication that it's not going to turn it into the long-term problem.
And so Tylenol, does that just block the pain? Is that the difference?
Exactly.
Okay.
It is not an anti-inflammatory.
Yeah.
Gotcha. All right, how about elections are hard on the heart?
I decided
Literally.
this was an important piece to do because we've got midterms coming up next month. So this is beware. It turns out that in the 2020 presidential election, in a study of over 6 million folks, that there was a 42% increase in heart attacks the week after the election compared to the 2 weeks before the election. I mean, you know, granted, stressful time, pandemic, but this was specifically around the election. So what this tells us is that stress comes in all kinds of forms. It's not just physical stress. I thought it was kind of interesting that they didn't look at the political party that had the most heart attacks, but it was primarily old white guys. Just putting that out there. But you know, the point is be aware as we go into election season and all these other stressful things. You know, stay calm. Don't let it get to you too much.
All right, a new way to prevent sexually transmitted diseases.
Yes, you know, as a gynecologist, I spent a lot of time talking about safe sex, and of course we talk about condoms, but condoms are not going to be helpful for every kind of activity. And it turns out that the FDA this week gave the okay to a new product that might help in other kinds of activities. So these are panties, underwear, that is worn by women. They are made out of latex, just like condoms, so that they don't decrease sensation. In fact, some say they may even increase sensation, and they are a barrier for viruses and bacteria that may otherwise get through. Now, some people have heard about dental dams for the same purpose, but I mean, unless you're a dentist, really, you know, where are you gonna get a dental dam? So these are called L'Oreal, and they're over the counter. They're about $6 a pair, one-time use. These are not something that you use. It's you wear them and you toss them.
So this is underwear to be worn during sex?
For some kinds of sexual activity.
Okay.
Exactly. And it comes, one size fits everybody. Evidently it stretches, very comfy. And we'll see, but it's kind of an interesting concept because STIs are on the rise in this country. So, and I knew that the WGN viewers would want this information. So,
all right.
And I'm here to help.
Wow. All right. Well, you can check out Dr. Streicher's podcast, the Menopause Podcast. And thanks for being with us.
I have a few more questions. Maybe you could stick around during the break.
I didn't want to ask too many.